This presentation is on a performance audit by the Queensland Audit Office on managing child safety information. The Queensland Audit Office delivers financial and performance audit services to give assurance to Parliament and the community about the performance and accountability of the public sector. We are committed to helping the public sector improve. Performance audit assesses whether an entity is achieving its objectives economically, efficiently and effectively and is complying with relevant laws. On 19 May 2015, the Auditor General tabled his performance audit report, Managing Child Safety Information. The Department of Communities, Child Safety and Disabilities Services protects children and young people who have been harmed or are at risk of harm. The department coordinates a number of government and non-government organizations to provide these services. These organizations include the Department of Education and Training, the Department of Health, Queensland Police Services and more than 156 non-government organizations. In this presentation, we refer to the end-to-end process from the department deciding to intervene to education and placement services as the child safety service chain. The nature of these services calls for swift collaboration and information sharing throughout the service chain. This was a clear finding in a coroner's inquest in 2014 into the death of a child. The focus of this audit was on managing information of children and young people under the department's care. There were approximately 11,000 children in care as of June 2014. We had two main questions. One, is the information available to authorised persons when they need it? And two, is the information secure? We found that the department does not have the balance right between security and availability of child safety information. Ready access to information remains problematic, mainly for service providers because the systems are not designed to share information across organizations. Information is stored in a number of different places, ways and formats across the service chain. This hampers effective coordination of services for at-risk children or young people. In addition, the department cannot provide sufficient assurance that child safety information is secure and kept confidential. Lack of system functionality makes it necessary for staff to take information out of secure systems and store it in less secure environments. The department does not have a clear and workable model for information flow throughout the service chain. It has not planned for changing reporting and information needs over time. Staff in regional areas have adapted by using spreadsheets and databases, and the department uses significant resources to prepare performance reports. This has resulted in the department having limited ability to apply a strategic approach to child safety services. It cannot easily collect and analyze outcomes-based data. We have recommended that the department develops a coordinated model for managing and sharing information across the entire service chain. Significant funding has been spent on the Integrated Client Management System, ICMS, over the last 10 years. Today, changes to the system are time-consuming due to the complex infrastructure and aging technology. Information is exchanged with service providers through emails, and each party within the service chain creates a subset of the same information. Quite apart from the duplication of effort, this also creates data integrity problems. For example, there were more than 1,000 records where children's school and residential addresses as recorded at school is different from those recorded in ICMS. This raises the question of which system contains the correct information. We have recommended that the department implement systems that integrate information across the service chain, automate information exchange, and enable outcomes-based reporting. There is no method for the department to easily monitor overall trends in key service outcomes, such as education. This limits the department's ability to improve outcomes and to assess how well the department is discharging its legal obligation to ensure children are actually attending school. The graph on this slide also shows that only 23% of school-age children had up-to-date education records within the department's system. Additionally, the Department of Education and Training Systems did not have enrollment records for 1,430 school-age children in care. Without examining each of the children's individual records, the department cannot know whether these children are attending school. We also looked at transition planning, which begins at the age of 15. The department's system did not have a significant number of young people's transition plans in their case plans. In addition, the Department of Education and Training data showed that 41% of young people in transition age group were not recorded as attending school. The department does not use this information, which, in fact, is critical to ascertain how well the young person will transition into an independent adult. We have recommended that the department uses information that is available across organizational boundaries to gain insights and to improve service outcomes. Security of child safety information. The department has adequately secured its key systems that hold child safety information, with the significant exception that it does not always remove staff access when it is no longer needed. In addition, staff routinely take information out of the key systems and store it in areas that are accessible to unauthorized staff. Information is also exchanged through internet emails. This brings with it risks of unintentional disclosure to third parties if the email is accidentally sent to the wrong email address. Practices such as these defeat the reason behind having a purpose-built system for securing sensitive data. We have recommended that the department improve security in the current environment through secure email services to all service providers and tighter access controls. All non-government organizations audited have implemented good practice information technology controls. However, there were some key controls that were not enabled. The nature and extent of control deficiencies varies across the organizations. While at one organization we identified security design weaknesses, 2 others needed to improve user passwords and access controls. Similarly, the risk management approaches differed across the 3 organizations. We have recommended that the department develop security standards that are included as part of service level agreements for service providers. Overall, the department has commenced work on 4 of our 6 recommendations and has a plan to commence on the other 2 in June-July 2015. We trust that this presentation has been of value to you. The full report can be found on the Queensland Audit Office's website. Thank you.